A Moral Right to Health Care, HCA 322, Healthcare Ethics and Medical Law, Professor Joyce Williams. Good afternoon, ladies and gentlemen of our esteemed Board of Directors. My name is Robin Awalt, and I am the hospital's compliance officer. Today, we will be discussing the moral right to health care, the 4 foundational documents that guide our organization, cultural competency, and resource allocation. In order to maintain optimum levels of health, individuals must have the right to access health care. A right to health care would potentially suggest health care for all. This would mean that hospitals, physicians, and clinic services would be available on an impartial basis for everyone. Dr. Paul Farmer stated, "I can't show you how exactly. Health care is a basic human right, but what I can argue is that no one should have to die of a disease that is treatable." So the debate continues as to how health care can be funded and barriers removed so that all can have access to it. There is no legal right to health care, but I believe as a society that we have a moral right to health care, and as an organization, it is our moral obligation to provide care to the communities that we serve. We authenticate this organization's moral character through our 4 foundational documents, our values, vision, and mission statements, as well as our codes of conduct. Our value statement is our organization's principles that motivate and direct us in the way we conduct business and treat people. Our vision is what our successful future will look like, and our mission is our reason for being. This organization's mission is to provide compassionate quality health care to the populaces that we serve. The codes of conduct for our healthcare organization is a combination of societal and/or community rules that govern us. Examples of this in our organization would be showing respect for all, being accountable, supporting one another, and listening intently. Our organization strives to display our moral identity in an optimum light as we have established principles with a successful future that is driven by our reason for being, which is to provide compassionate quality care to all of our patient populations. This organization provides quality care, and we attribute some of this to our moral commitment to being culturally competent. This competence allows this organization to interact with diverse cultures and provide care that aligns with our patients' beliefs, values, and needs. A culturally competent organization continually assesses organizational diversity, invests in building capacity for cultural competency, practices strategic planning that incorporates community culture and diversity, implements prevention strategies using cultural diversity as a resource, and evaluates the incorporation of cultural competence. Our organization is committed to our diverse community. We mandate that our workforce attend cultural lunch and learns, and we also have located on our intranet an employee blog that is a venue for our staff to share different cultural recipes, traditions, and values that pertain to our very own diverse workforce. In the current healthcare climate, with scarce resources, this organization allocates these resources respecting our moral commitment to our community and the patients that we serve. Our leadership should follow the principles of procedural and distributive justice when allocating these scarce resources. Procedural justice is a guarantee that the process is fair and equitable, and distributive justice is a fair distribution of goods. In this organization, we evaluate demographic and population health data to determine resource allocation in a way that minimizes discrepancies associated with socioeconomic status. Leadership also attempts to maximize resource allocation as much as possible without affecting the hospital's economic viability while maintaining our moral character. So in closing, there is no legal right to health care, but our organization is morally obligated to treat all of our patients based upon the guidelines provided from our foundational documents, supporting cultural diversity, and the fair and just manner that we allocate our resources. I thank you, ladies and gentlemen of our board, for supporting our organization's commitment to the community that we all serve. Questions, anyone?